Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are talking about innovation in virtual care to transform CV health. So joining us today, we have Dr. Kristi Artz, a certified lifestyle medicine specialist, also medical director of Corewell Health Lifestyle Medicine. Thank you for joining us, Dr. Artz.
Yeah, thanks for having me.
You know, we want to really talk about virtual care because I really think this is what patients are demanding. They don't want to come into the office if they don't have to. So what are some of the unique challenges that practices face when trying to integrate this into their daily flow?
Right. Well, I think most practices need to first understand that virtual care is just a modality, a way that we can deliver care. It's very patient-centered. As you said, most patients are really seeking this type of care. I'm in Michigan. We get a lot of snow in the winter, right?
Yeah.
Patients don't want to be traveling. So it's a way that we can stay in touch with our patients more easily, whether it's our nursing team, our dietitians. I work in the lifestyle space, so we have team-based care. It's a modality that we can use so that all of our team members can be checking in on that patient, ensuring that they're making the proper health behavior changes, that they're going to see improvements in their health.
Is that really that first step, kind of going through and looking at what you offer and then what really does make the most sense, the best fit for that virtual patient?
Right. And most patients, I would say, find that they enjoy a hybrid model.
Mm-hmm.
So they would like some of their care to be in person. They want to sit across, and talk to someone face to face. I think there's a lot of value in that, but they also want the convenience. Some of our patients are really busy with work and school and families. And so the ability to connect with their clinical team, even from a work site, it brings a lot of value to that patient-clinician relationship.
Yeah, when you're talking about the patient and patient-centered care, lifestyle medicine is so important, integrating that into the practice. What's one way that you found is very effective when doing that?
It's really understanding what is the patient's goals. I think so often the way care has often been delivered in the past is that, we come into the room and we tell a patient what it is, their diagnosis and what we're prescribing and, go off and do all these things that we told you. Lifestyle care is very different. You really flip the model, and that's what makes it so patient-centered. Melanie, what are your goals? What are your concerns? How do we support you best to achieving that so you realize those health improvements? So flipping that model, understanding where they're ready to begin, whether it's around nutrition, physical activity, stress management, better sleep quality, tobacco and nicotine cessation, or reducing alcohol consumption. These are all factors that we know contribute to the vast majority of our cardiometabolic disease. Mm-hmm. And when you can engage a patient in those types of conversations, I think they really tend to light up. They feel like they're being heard, mm-hmm. and they, you've developed that trust with the patient.
They have a little control too.
Correct.
Over their outcome versus someone just telling them, take this pill,
That's right.
do this thing, and it's going to help you, but they're actually contributing to that whole process.
Right.
Yeah,
a lot of care is out of the control of a patient if they're having a procedure done. Lifestyle-focused care is, again, vastly different. They hold really the key to change. And it's my job as a lifestyle physician and my team's job to really support them and make sure they're getting, the skills, the knowledge, and the accountability that they want to be successful.
Yeah, you were saying that this is a really good space for virtual care.
Mm-hmm.
This lifestyle. So what are some of the best practices that every type of organization can take when making virtual care more efficient for the patient and for the physician?
We're very fortunate that a lot of the electronic health records now offer the video directly in the patient's portal. Mm-hmm. So I think just understanding that we need to make patients aware that it's available. Sometimes patients just don't even know. So if we say, hey, this is an option, 9 times out of 10, they'll oftentimes choose that virtual option, at least for some of their care. Maybe not all of it, but if we can reduce the amount of time and travel and disruption that we create in a person's life, I think we're doing, our patients a real service.
And is that a training piece too, for the patient to really truly understand their portal and all that it has to offer?
Yeah, so it extends beyond the clinical teams. We need our informatics teams, our technology specialists, but fortunately, a lot of the virtual care now is, it's click to start the visit. I think it's oftentimes just having the patients realize it's easy, but on the clinical team side, there's always workflows that we need to develop, make sure our front desk teams feel comfortable talking about virtual options. And even in the moment, our teams even will flip an in-person visit to a virtual visit if the weather changes or the patient finds that they're running late. It's a great option so a patient doesn't have to miss their visit.
Yeah, and that's nice to have that flexibility to know you can make a phone call and be like, I can't make it. Is this an option for me?
Right, and that's practice efficiency.
It is, yeah. I have an 82-year-old mama who has learned how to use her portal in that way, and it always surprises me because sometimes I'm like, are you sure you know what you're doing? And she truly does. So I think it is for everybody.
Correct.
Yeah. So do you have any specific examples of strategies that positively really impacted the patient care using this virtual model?
The model that I discussed in our session earlier was around collaborative care. So collaborative care is a team-based model. We deliver lifestyle-focused care within this model, most of it being virtual, telephonic, and even group-based. So they're in a group with other patients, so peer learning occurs, but that's even happening in the virtual space. So we can really break down a lot of barriers, bring this type of lifestyle-focused care to patients, because that's where, their health behaviors begin, in the places where they live, where they work, where they, spend their time outside of their clinic visits. So the collaborative care model is very much suited to this hybrid and or virtual first approach.
Yeah. All right. Well, thank you so much for sharing, Dr. Artz. Definitely some food for thought. Thank you so much.
Thank you, Melanie.